really, I want to highlight just a few genes that have to do with diet that are extremely common in most of our patients. And when we evaluate the genome report, there's 87 pages that we generate in that report. So there's hundreds of different genes that we're looking at. So the first one, it has to do with gluten. And again, as Dr. Bowers mentioned, the more variants there are in a specific gene, the greater likelihood that one has an issue with that particular gene or that particular problem that could create. However, again, it's not your destiny. The first one has to do that I want to highlight is with gluten. So that's the HLA and the KIAA gene. And again, the more variants you have here, the greater likelihood that you might have an issue with gluten digestion. In other words, if someone presents to our office with, a whole myriad of issues, but particularly gut issues, skin issues, neurological issues, respiratory issues, and they happen to have a high amount of variants within one of these genes or a combination thereof, that could potentially mean that they're predisposed to not being able to break down gluten. And in that hypothetical patient, if they're consuming a lot of gluten, then it would behoove them to stop consuming gluten. So it's pretty straightforward.